الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Food poisoning by Professor Mahmoud Hani Sulaiman. Definition: caused by bacteria or toxin residing in food source, derives from infection within animal or contamination during food storage or preparation. It is acute inflammatory disease of GIT due to eating of contaminated food, either toxin-producing bacteria, preformed toxin, or chemical substance. Other poisonous food substance. Clinically, short incubation period, pain in abdomen, vomiting and/or diarrhea with or without fever. Food poisoning differs from foodborne disease in that it is not transmitted by fecal-oral route. It is transmitted by food. It also differs from food intoxication in that there is neither toxic factor in food grain nor there is contamination with fungus. Epidemiological features of food poisoning: history of ingestion of common food as in marriage, dinner, hostels, and etc. A group of persons ingesting common food affected simultaneously, similarity of symptoms and signs, short incubation period, absence of secondary cases. Classification of food poisoning: broadly two types, non-bacterial or bacterial. Non-bacterial food poisoning consists of following types: mushroom poisoning, solanine poisoning, chemical poisoning. We will describe them. Mushroom poisoning: two common poisonous mushrooms eaten in mistake for edible mushrooms are Amanita pantherina and Amanita muscaria. Their poisonous effects will lead to presence of muscarine. Symptoms in a few minutes or hours. Okay, abdominal pain, then vomiting and diarrhea. Sometimes may be sweating, twitching, meiosis, diplopia, muscular incoordination, convulsions, then coma. Atropine is effective antidote. Amanita phalloides is highly poisonous fungi. It contains amanitin, which is cytotoxic, and phalline, which is hemolytic. Cytotoxic and hemolytic. No antidote for this. Mortality may reach 90%. Both of these are destroyed by cooking. So symptoms produced only when they are improperly cooked or eaten raw. Other poisonous eatables are mussels, in Egypt called balah al-bahr, and seafoods. Solanine poisoning. Solanine is toxic alkaloid present in peelings of potato, especially in sprouts. Symptoms occur in few hours: fever, headache, abdominal pain, vomiting, diarrhea, weakness, and depression. Patient usually recovers in few days since alkaloid is soluble in water. Potatoes are boiled and peeled. This is enough. Chemical poisoning, the third one. Inorganic chemical substance will lead to poisoning are pesticides, fertilizers, arsenic, zinc, mercury, etc. So can be occupational. It can contaminate foods of workers. Bacterial food poisoning due to consumption of food contaminated with either toxin-producing bacteria or by their preformed toxins. So two types, namely infection type and toxin type. Infection type equal organisms enter body through food, multiply, produce toxin, cause pathology, clinical symptoms and signs. Incubation period 12 hours. Bacteria will lead to this type of food poisoning are Salmonella group, Clostridium perfringens, and Vibrio parahemolyticus. Toxin type: there is already preformed toxin in food, so incubation period shorter than that of infection type. It is about 8 hours. Bacteria will lead to this type of food poisoning are Staphylococcus aureus, Clostridium botulinum, and Bacillus cereus. Differentiation of bacterial poisoning is shown in the coming table. Staph, source found in everybody's skin, nose, and throat, pyoderma of food handlers, or mastitis of milking cow is a good source. Milk and milk product, custards, Russian salad, milk is added to every prone to contain staphylococci. So milker and food handlers are sources. Mechanism and clinical picture of staph food poisoning: preformed toxin in food which is heat resistant and acts directly on GIT. Will lead to sudden onset of nausea, vomiting, diarrhea, fever, and death. Is rare. Incubation period may reach 6 hours. Then Bacillus cereus. You can print and use this slide. Clostridium, Salmonella, with Clostridium botulinum. Is this a separate lesson? Please print and use. This is important. Investigation of food poisoning outbreak. Important 9 steps. Always remember 9 steps. First, there is suggestive clinical features. Verification of diagnosis. Find index case and secondary case. Ask for personal characteristics. Food history. What, when, where. Go for lab diagnosis if possible. Do not forget to treat patient. Then, verification of epidemic. Active search for new cases for treatment and epidemiological characterization. Define the population at risk. How many people ate that particular food. Remember, enumerate all the cases. No sampling is allowed. Then, 3. Full up epidemiological case sheet. Ask all the population at risk to fill up personal characteristics and food history. Then, this is description of how collection of basic data, as location of place where affected people had taken food. Interrogation of all participants. Nature of food eaten during various 2 days. Time of onset of symptoms. Nature of symptoms in order of occurrence. Personal data. Number of dishes, if any. Assessment of environmental factors as kitchen. How to inspect a kitchen. Assess sanitation of kitchen and dining hall. Know nature of storage food grains. Nature of storage cooked foods. No presence of rodents. Interrogation and examination of food handlers, other employees regarding personal hygiene habits and illness, if any. Data collection continued. Lab investigation as vomiters and stool of patients for culture and aerobic and anaerobic media. Sample of suspected food for culture in both media. Serological test of blood of affected persons for antibody titer. Culture of stools and urine of food handlers, kitchen employees. Data analyzed according to descriptive methods of time, place, and person. Food-specific attack rates and case fatality rates. Etiological hypothesis formulated. Case control study to establish association, prevention, and control. The 4th step, prepare the epidemic curve. This will give you the incubation period and the probable causative agent. Then, 5. Evaluate the environment as kitchen or restaurant. 6. Data analysis described in detail later. Formulate cause-specific attack rate. Then, example of investigating an outbreak of food poisoning. Epidemiological studies are usually carried out to describe disease and its pattern in a population, analyze risk factors which determine why some people are affected and others are not. Here I will focus on some practical issues involved in epidemiological studies using an outbreak of food poisoning as example. First box, first table outlines initial actions that would consider including basic descriptive epidemiology. The next step will be to perform an analytical study to try and identify cause of the outbreak. The key issue with analytical study is to compare one group of people with another group to be able to draw meaningful conclusions. It is therefore the comparison between two groups of people which gives a better idea of risk factors association between exposure to the food and outcome poisoning. For such situations, there are two types of epidemiological studies can be carried out: case control and cohort studies. Example: a wedding party was attended by 200 guests. Following the wedding meal, a number of people become ill with diarrhea and or vomiting. The initial actions will involve speaking to the people who were ill to get some information about the illness, probably using a standard questionnaire. The initial questionnaire would provide descriptive data on people who were ill and identify any common factors that may require further investigation. Descriptive data could include age, gender, geography, onset of symptoms, type of symptoms, and any common factors as attending wedding and eating wedding meal. Calculate odds ratio if exposure to each risk factor in cases compared to controls. For example, if exposure of interest is raw salad and distribution is as below. Cases, those who have the poisoning, and controls, ate salad, did not eat salad. Odds of exposure in cases, 40 by 10 equal 4. Odds of exposure in control, 20 by 30, 0.66. Odds ratio is 6 approximately, 4 by 0.66. This suggests that those who became ill were more likely to have eaten salad items at wedding compared to those who did not become ill. We can look relative risk or risk ratio of developing outcome for particular exposure if we stick to salad items as exposure and distribution is as below. Food poisoning, no food poisoning, ate salad and did not eat salad. Risk of developing food poisoning among who ate salad, 40 by 100, 0.4. Risk of developing food poisoning in those who did not eat salad, 10 by 100 equals 0.1. Relative risk equals 4. Those who ate salad had 4 times risk of developing disease compared to those who did not eat salad. Formulation of hypothesis: construct the chain of transmission, reservoir, mode of entry, susceptible host. Then, 8th step, test the hypothesis, do an analytical study. We described it in details. 9, report, summary, recommend, control, evaluate current strategy. Prevention of food poisoning. First, taking care of food. This consists of the following food hygienic measures: proper storage of food grains, proper cooking of food, protection of cooked food from rodents, insects, and bare hands, eating the food while hot, discourage canning of food, refrigeration of remaining food. Taking care of food handlers. They should maintain a high standard of personal hygiene. They are educated about the hazards of unguarded coughing and sneezing. They are educated to undergo periodical medical check-up. They must abstain from the duty if they develop septic skin lesions, respiratory and intestinal symptoms. Carrier should remain absent for the duty till they are cured bacteriologically. C. Taking care of environment. Kitchen and dining hall must be clean and dry. Utensils should be thoroughly washed with soap and hot water. Rodents and insects must be controlled. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you for your good listening and watching.